Okay, everyone. I think we are ready to get started. We do have some people still coming in. So, welcome to our debriefing for the 2026 Authentic Awareness Award, or not award, but Autism Assembly, the actual assembly.
We all get an award, Jackie.
Yeah, we all get an award.
We all get an award, which is get an award.
For sure. I'm going to share, I have slides, but I'm not going to be using them the whole time. I'm just going to kind of use them to show us what we're doing on each step. Part of this is going to be you sharing your stories, and then we're also going to have some action steps for you today, so be sure to stay through the whole thing. If not, this is being recorded, and you can always catch it afterwards. We want to just kind of start out in the beginning here, hearing from you guys, and just talking about the assembly, what your thoughts were on training day, what your thoughts were about Hill visits. We are going to talk more in depth about how the actual visits went and what our next steps are for those policy planks. But for those that didn't attend, for you to know what has gone on. So those that did participate in this year's event, this was our second Authentic Awareness Autism Assembly. It was very different than the first. It was all in the one bubble. And we had it at the Embassy Suites DC Convention Center. Just like last year, prior to attending our assembly, all of the participants were provided 4 hours of training on basic etiquette for meetings and what to expect there, training on how our advocacy style is, preparing them on their pitches. They all put in a lot of work before ever even coming to DC and learning what those policy planks might be and studying their legislators and things like that. The day of the event, we had from 9 a.m. to 4 p.m. was speakers. We had speakers from the Administration for Community Living, speakers from the National Institute of Mental Health. I see Phil there on the screen. Phil and Adam were there from Helpopedia. Steve and his friend Michael Skinner, who's a filmmaker, were there. So we had a lot of different speakers. We also trained on the policy planks. We had breakouts. And then in the evening, we had an awards ceremony. And we had more awards this year. We were able to celebrate some of the best in our community, providing really exemplary service in a variety of areas. And then we ended that day really hitting home what this is all about, being able to be the first previews of a new documentary that's coming out called Uncertain. And the film producer, Amanda Dyer, came all the way out to DC from Tennessee and provided us a sneak peek of that documentary that will be out soon. The next day is when we all went on the Hill, and it was incredible. And so we had 2 policy planks this year. The first, we were asking our legislators to send a letter to CMS to make changes and prioritizing severe and profound autism. Some carve-outs for the settings rule for us, as well as really focusing on some of the data issues that we have where our children just disappear in the big aggregate data, right? And we're trying to get that fixed with CMS. We are not going to have you all individually contacting CMS, so that's not going to be an ask we're going to have you continue to take, but we are going to have you do something on Medicaid. So stay tuned for that towards the end of this call. The second policy plank we had was asking Congress for a federal study on severe and profound autism caregivers. We had Dr. Dawn Turnage there from Florida, who has published on this, why severe and profound autism is its own unique subset. The federal government has studied caregivers. There's a National Family Strategic Plan. They've studied caregivers that are caring for their aging parents. They've studied caregivers broadly, but they haven't studied us. And so the current federal data says that caregivers provide this care on average 5 years. We do it on average 5 decades or more. So we definitely need a study that focuses specifically on us, because we're the first generation to do this post deinstitutionalization. And so what's happening now is a lot of us on this call, I would imagine, have heard, you've tried to take your child into the hospital or for some type of care, and you're told by very confident professionals who have 18 years of education and residency in their fields saying, we can't help you, we don't know what to do, and they send them back home with you, right? So we are the experts in this, but we're not going to live forever. And so we want them to study us so that they can gain that information, and then it can be replicated into formal supports that can outlive us, so that when we're no longer here and this is left to others to do for our children, they actually know how to do it. And the only way they're going to know how to do it is if they study us. So we're going to be asking on that. So those are our 2 policy planks. That was kind of how our week went. A lot of us stayed the extra third day and we hung out. Some went on tours and did things in DC together. Some went to the zoo. Just kind of jump in and share what you thought of the experience.
I'll share. I don't know. Can you hear me?
Yes.
I'm actually in DC now with my 2 boys, and we managed to scare everybody, small children, on the mall. So I'm a little rattled. But what I felt my meeting with Representative Moore, who was formerly Speaker of the House in our state, North Carolina, and he did a lot within our state to expand our waiver program. He mentioned that he's currently working with another representative from Michigan on strengthening DAC, which is the Social Security payments for people with disabilities who were disabled before the age of 22. So that parents can get, your kids, your adult children can get 50% of your Social Security while you're still alive, and then 75% of that after you pass away, and it doesn't count against their asset limits, but he's working on strengthening that. He was very open to working with us. I've sent him a thank you letter, but he, just given his background and what he's done in the state of North Carolina, I felt our meeting went pretty well, and he definitely seemed interested in working with us. And my other meetings I felt went well. My plank was the home and community-based settings rule, and told my story, how we're personally affected by it, and I felt that those stories resonated, and I thought everything, the training, everything was great. Really fantastic. Great job, Jackie. Everyone who helped organize this was fantastic.
I'll share. Oh, can you hear me, Jackie?
Yes.
Everybody hear me?
Sure can.
Yep. So Kim McCafferty, this was my 2nd year attending, even better than last year, if that was humanly possible. Speakers were so inspiring on Tuesday, and I felt like we all got to know each other better, and we had ample time to work together on the different issues we would be discussing with our legislators the following day. The award ceremony, wonderful, and the entire Tuesday just went wonderfully. This year, NCSA NJ, we were fortunate enough to get an entire hour with Congressman Chris Smith, and I wasn't able to stay for the entire meeting, but Pat and Mitch and Ellen, or not Mitch, actually, Pat and Jonah and Ellen were able to stay, and they got to express to him all their concerns, all the things they're hoping he will be able to help our community with moving forward. And that was fantastic, because we weren't able to get a meeting with them last year. And then we also went to Senator Kim and Senator Booker's offices. And what was lovely was they were the same legislative aides we had met with last year. So we already had a rapport and a history with them. And again, got to convey our concerns and express exactly what we were going to ask them to do for us. And I thought I only attended the 3 meetings, but all of them went beautifully, and looking forward to next year.
So I will just finish up from Kim because, Kim would and I think Congressman Smith have a very good relationship and a very, a close relationship. But it was the first time I ever met with him. And I thought he was such a, I think he is the head of the Autism Caucus in the Congress. And I thought he was really he offered to do anything we asked. He was really terrific. And his legislative aide also very, very helpful. We also met with our new Congresswoman, Mejia. And so she is new to all of this. She's new to sort of everything. She didn't even know some of the towns in her district yet, but she seemed very interested. And I think she worked a lot with Loretta, born out from our group, to talk about some of the shelter workshop issues. So we went beyond that. And Joan and I got to see Mark Kelly, who we knew from a different way. And he was very helpful. He actually mentioned to us which he did last time too, that he's a friend who's in West Orange. Although he's Arizona, he's originally from New Jersey. And that he has a friend in West Orange who has two sons with profound autism, and was very interested in the subject. So we were with a whole group of people with him. We were with the Future Farmers of America from Illinois. So it was a whole group of people in our meeting, but he was very helpful. And I think he's someone who we could in the future consider a friend. Was anyone there from Arizona? Jackie, I'm not sure if
I don't think so this year. There was last year, but I don't think so this year.
Okay, so at least we got to see him, and we told him why we were there, and he spoke to the group about that. He just sort of let us in. But otherwise, I will echo everything Kim said.
Same. This is Pat. I'm sorry I'm in the car, so no camera, but I just echo the same as Ellen and Kim. I think it was a fantastic 2 days. I thought the speakers were wonderful. I think we all learned a lot. It's great for New Jersey because we have a lot of people who come down, and it just builds momentum. It brings us closer. It allows us to share in a way that we really don't often in New Jersey. So I think it was great. And I think every person we met with, which were many, I think 7 meetings altogether. Some of us went to some and others, but what I heard collectively was that all of the, legislators were so open and understanding and knowledgeable, which was refreshing. So it's just another great meeting. Thank you, guys.
All right. Well, I guess I'll go on. So from New York, we met with Senator Gillibrand's office, and we met with Grace, and she clearly understood the assignment. She understood our legislative priorities and the urgency behind them. I followed up with a thank you. We will be setting something up for August. We talked about the HCBS reform. Let's see what else. We spoke to Senator Schumer's office, and they wanted to see what Gillibrand's office said and needed to do more research on HCBS as well. John Mannon's office requested our leave behind materials, and Jackie Sionzo is going to follow up with them. And what else? Overall, everyone seemed to be pretty responsive and positive. Follow-ups are happening pretty much next month. And I thought the conference was so emotional. I think it's so different meeting with caregivers versus the other, conference that I went to where you're meeting with educators and medical people. So if you saw me, I was probably crying the whole time because it's just touching to see everyone. So I look forward to attending again. And I think that's all I have to add.
I was there with Jillian with Schumer's office and Gillibrand. It was interesting. Schumer's office mentioned that I think it's the CARE Act, and I'm not an expert in this, Jackie, but they were sharing with us that the process started already, that they submitted.
Yes.
Yeah. So I think that's an important point. And so one of the things I mentioned to them, because they were kind of pushing us off till further months. And I flatly said, listen, I know when I'm a decision maker, if there's information I don't know about and I haven't made the decision yet, I'd like to know that intel. And one of the things I shared was the powerful concept of establishing best practices through this survey solution to share with families, which makes them the heroes in this story. Yeah. Because this activity is really important to gather that insight for all families. And then it's using those strategies that are captured through every single part of the life, even what worked in the past, what doesn't work now. That is incredible insight. And so I shared this with the two staffers who were there, and hoping that they're able to communicate that message back to let them know that this shouldn't be just assumed that nothing could happen from now till 8 months from now, as it relates to trying to get this activity initiative in that CARE Act. So Jillian, if you think you need to add, or if I said something wrong, certainly, and Steve too.
I did forget though that we did, they are interested in possibly meeting with some of the programs, whether it is going to a group home that Rita's son is at, or any of the programs that Steve has created. We do have places all throughout the state, and there was an interest in that as well. So I think, yeah.
I'm wondering if anyone else received that feedback about the importance of the timing that we were there.
Yeah, you bring up a really good point, because the first year we were there, April 2nd and 3rd, which was the kickoff of Autism Awareness Month. It was very different reception this year. And we have some back end conversations going, whether we keep it this time of year or not, because we were coming in while they were doing appropriations this year. So this is we weren't asking for standalone bills. We were very strategic about our asks. The real only sole legislative ask we had was around the caregiver study. And that is something they can slip in as a couple lines into an appropriations bill. It doesn't have to be a standalone bill of its own. And so we got very positive responses on that, because it's not asking them for all this additional funding to fund a new program. It's actually program integrity. They're already funding all these things, but they have no idea the data of what they're funding, because they've never actually studied us specifically. And I think it's going to be very enlightening for them if they do. And my congressman is Ways and Means. He's a Republican. He's as fiscally far right red as you get, and it was even very appealing to them. So this is something I think that we have broad support across Congress of studying severe and profound autism caregivers.
I think for New York, both everybody that we met with thought it was just a very easy thing to accomplish. $5 million, part of $2 billion. It was very hard to say no to that. It was just a matter of, as Phil said, the timing, being able to get it under the belt now or later.
Good. Right. And we're going to have more time to talk on all these things, but let me show you here what we have next. If you did attend, these are critical things we need every single person that attended to do both of these things. We need you to log your meeting, and we need you to send a thank you to your legislator. It's in your follow-up email, but if you have lost your follow-up email, you just go to our website /take-action, and it opens our Action Center hub. And you can log your interaction here, log interaction with officials. And you have to do this for each official you met with. So, for example, I met with Congressman Kustoff, and I would write that, and there it is, Representative David Kustoff. And then we had an office visit, because we were in their office meeting with them. This one is one I'm having to do a lot in the back end to fix. Make sure you select July 15th. That's the date we all met with them. Even if you don't remember the time, I don't really care so much about that, but I definitely needed to say July 15th. And then tell us how your meeting went. What was the reception? Which policy plank or both did you talk about? Do you need NCSA to follow up? What specifically do you need us to follow up with? And then submit. But we need everybody to do that. The other thing that we were going to have you do is send your thank you. I think that is in your, here it is. It is on, nope, that's voices. It's in the email, but it's not here. So I will find that before the end of this meeting and give you that. But we do have a form for you to send a thank you to your legislators. So we need everybody who did participate to do that. Most of you have already, which is I'm really grateful for. Thank you. But your lives are anything like mine, which they are. If you got busy, it's okay. Please still do that. Elena, you have a question?
Yes. Hi, Jackie. I think I sent my thank you from the link on that last page you were on. So was that a mistake? I sent it from the Voices link.
I don't think it's a mistake.
I mean, I made the mistake is what I'm saying.
No, I don't think it's a mistake. It actually might be okay.
If you went through the link in the email, it was
what? It actually is.
If you went through the link in the email, it was fine. I wrote my own, and what I did was just what Jackie told me to do is I just went in and pasted it in like what I wrote in the comment part and noted that I sent something, but I didn't send it. Sent the one from that was pre-written.
Yeah, let me show you here. You know what? It was
really
correct.
Easy though. Once I saw the site, I sent it before you sent the links out. So
it is correct. I just went to it. It is correct. I just didn't replace the subtitle, which they don't even see. So don't worry about that. But you're right. This is where it is. This is where it goes. When you click that, it automatically pulls up your legislators. You can edit it. So maybe you were one where like North Carolina had, but neither one of their senators had time to meet in North Carolina. There was a lot going on for them that day. So you would edit officials and you would uncheck if you didn't meet with them. But it's automatically going to put your officials in here. This is already like the subject, the message here. This is where you edit it. You go to edit and you can delete this and put your own message here. The reason we ask you to use this is because it also provides them our information if they want to contact us on some other things, and it has the plain text links that they can access the broader policy packages that we had. Legislative inboxes are very persnickety as far as like what's going to be allowed in, and then a lot of things get filtered out, and so we can't send anything like attachments, anything with tracking IDs. Those kinds of things all get picked up by their software and it gets kicked out. Our software is built to ensure that your email actually gets to your legislators. So by using this, then you're able to get through. So that's how you use the thank you one. And I will go into quorum later and delete the subtitle that still has voices, but it is right. It is the correct one. That's how you send your thank you. Is through there. Did anybody have any questions before I move on to the next thing? Does anybody have any questions on how to send their thank you or their follow-up?
I have a quick question. So for the link on sending the thank you, so I'm North Carolina, so my representatives or my two senators were not available. But I did meet with, I already sent Tim Moore an email, but for Brad Knott's office, I met with his policy guy. Is there any way that I can, do I send it anyway to Representative Knott, or is there any way I can modify or edit it?
I'm going to go in the back end of quorum, and I'm going to have to adjust that.
Okay.
Because I think it has it set to only your legislators.
Okay.
And I can adjust that on the back end of quorum for you. So,
okay.
Christina, make sure
I was able to send to the California LA that we met with for shifts. His name came up in the drop down when I typed it in.
Okay.
Okay. So,
well, I will check on that at the end of this. I will definitely check on that and make sure you have access, because I do know some of you met with people that were outside. Typically, and it's part of the way that the software works to our advantage most of the time, is that it's set that it'll show you only your legislators, and that's also so we don't get blacklisted. So if we had somebody in Oklahoma that was like very passionate about their cause and wanted to use one of our campaigns to send to all the legislators across the country and that kind of thing, the legislators would start marking it as spam, and then none of our emails would start getting through. So we often limit it to your legislators only. But there are cases where we can do a workaround for that. So this is one of those times I need to make sure that's in existence for you guys.
Yeah, I would like to send one to Vinman because that meeting was interesting. I do think he was listening. He gave us quite a bit of time, but I'm not technically in his constituency. So so we'll all be in touch about that. If you're in that situation, maybe just message me and then we can all coordinate that vote.
Yeah. Yeah, and we have their emails to their offices. So if you run into anything like that and you need an email for a specific office, just message one of us. Christina, myself, Steve, Mitch, and Kimberly from Pennsylvania all have access to quorum backend. So any of us can get you the information for the different offices or staffers that you might need. So this is going to be your first action step. Like I said, we talked with our health policy source, our legislative consultants that are in DC. They did not think it was a good idea to have our individual advocates send letters specifically to CMS yet. But during our training day, Mary Lazar here on this screen is the administrator for community living. And she talked to us about how the Medicaid issues need to be taken to the states. And because states have broad discretion on how Medicaid is administered. There's a lot of talk about Medicaid on the federal side of things and the Medicaid funding and those kinds of things. And we obviously at NCSA are working steadily on all of those issues, including direct contact with CMS. However, the biggest impact you can possibly have on Medicaid is taking this directly to your states. So we have created an action campaign that is for your states specifically, and everybody, whether you attended DC or not, can participate in this. And we want you to participate in this. And we want you to share it out once you do participate in this. And I'm going to show you how right now. And if you ever need to get to this, you just, like I said, you can go to take action, but you can see all the campaigns here. And it's this one. Tell your state, prioritize severe and profound autism in Medicaid. Now, the first time you come to the Action Center, let me actually go back because some of you might not have done this before. Go back to the homepage of this. Maybe. I told you my internet was being crazy. So the reason I'm able to get through all of these things is because I'm already logged in here. The first time you come to this, it's going to have a form. It's going to ask you to fill in your name, your address, your phone number. It's only going to do that if you're not signed in. I'm signed in, so I can go through all these different things. But that is how it matches you with your legislators. That's how it autofills your state and your name and those kinds of things for you in these campaigns. So don't be alarmed if you come to this action page the first time and this is a form for you to fill out. You won't have to fill it out for every single campaign as long as you're logged in. So this one would be, the one I'm talking about right now is to tell your state to prioritize severe and profound autism. And when you click it, it tells you what the action campaign is, and then it has Act Now. And I'm logged in as NCSA, which is headquartered in California. So it's showing me who this is going to go to. The governor, Gavin Newsom, Dave Cortese, and Gail Pellerin. These are state officials. These are not federal. These are state officials. And again, we have this email that is the message up here. It autofills this. So you see where it says like, Dear Governor Newsom. It's going to send 3. Governor Newsom, Dave Cortese, Gail Pellerin. You're seeing the first one listed, but it will send it to all 3 in their name, not all 3 Governor Newsom. It's going to autofill that. And it says, I'm writing about how California runs its Medicaid program. So it's automatically filling in that information of what state you're in. Right here is where it says edit, and you're going to click that, and you're going to make this your own. You're going to tell them why this matters to you, why you need them to prioritize severe and profound autism for your family. And then it automatically, this says National Council on Severe Autism, but this would say, Christina Gaudio out of Nashville, Tennessee, and would have her email address here if this was her filling it out or whoever it might be. So it's going to autofill some of the things for you, and then you would submit it. The second part of it is this X post. So it gives you these options here where you can then share this on X to get more coverage on this. So it's going to autofill whatever your legislator's X handle is and say, please make severe and profound autism a priority and then it'll fill your state's Medicaid decisions, protect the waivers and round-the-clock supports these families can't go without, and you would send those. Once you are finished posting, I'm afraid to do this. Okay. Once you, I can't go through it without actually doing this, but once you're finished posting, it will then give you an option to share it to Facebook, LinkedIn, and X for you. Please do that, because that then lets more people know that this campaign exists and you want them to help participate in this too. You want them to join in on the campaign. Elena?
What if you don't have an X account? Sorry if that's a question, but can you still do it if you don't have an X account? Or
if you don't have an X account, I don't think you could do the X part of it. But you would just click where I just did, where I said I finished submitting. You can click that at the bottom there, even if you don't send the X part. It'll let you proceed to the next part where you're going to share. You have to do the email, which I didn't want to submit because, it will go to those officials. You have to do the email. And then once you say I finished submitting, it'll then open to the share options, and it'll let you share that campaign to your Facebook, to your LinkedIn, to wherever. And you can select which ones or all that you want to share it to. So that's how you work a campaign like that. And that's what we're asking you to do as far as Medicaid right now. If you want to see for yourself, if you are not in DC and you want to see for yourself what we did present to legislators, going to NCSA's webpage, under policy, these 2 things here are what we presented. The letter to CMS is what we asked our legislators to send to CMS. This is what that letter was. We presented them an editable document because the legislators would download that Word doc and edit it however they wanted. This is kind of our sample. We're pre-giving it to them, but they can change it however they want. And specifically, these three things are really the meat of what we were asking them to do. We were asking them to, on the federal side again, this is not the state side, on the federal side, we were asking them to use the federal funds as intended and meeting the need for high acuity individuals, targeted reform of the settings rule, and strengthening of safety oversight, and then disaggregated data reporting. Michelle presented on that part of that, which is, again, where our kids get lost in the data. The states only have to report the big data, the overall data. So, imagine if in school, schools only had to report how students were performing overall and didn't have to report specifically the special education classrooms and how that data was going, right? Our kids have separate data in special education, but then once they become adults, it's like waivers, forget it. We don't have separate data, and then they get lost in the data. So we're asking for those changes on the federal side. And then on the caregiver side of it, we had a really detailed brief available. If your legislators want it, they can go here. We have a really detailed brief that we have a very pretty PDF they can download that goes into depth about why we need this, why it's possible, what we want them to study, what we want them to do with the data, how they can implement it, what it would cost. All of that is in this very detailed brief here. You are more than welcome to read that as well if you really want to get into what we did in DC. Well, before I go on to our next section, does anybody have questions on sending an email to your state legislators, your state representative, your state senator, and your governor? Is everybody on here able to, they feel confident and able to do that part? Okay.
Jackie, actually, I have a quick question. When I signed up on Quorum, it has my state representative incorrect.
That's definitely something I need to know. So if you can send me an email with that so that I can contact Quorum support.
Got it.
Yeah, that's interesting. Texas, I think, might have that issue because Ginny's in this kind of no man's land. Is Ginny on a call? Oh, Ginny is here. Yeah. Ginny, is yours correct on there? Because I know Texas is going through some changes.
Yeah, mine was correct for the federal representatives. So the senators and my member of the House was correct. Now I actually also got to meet with who's going to be my new member of the House after the redistricting goes through on January 1st. They were kind enough to meet with me, and I just took the letter that went to Congressman Menifee and copied it, and then separately emailed it to Congresswoman Fletcher. So I was able to cover that base since I got to meet with both of them. So,
perfect. Great.
Yeah.
Okay. So
it worked out just fine.
Fantastic. So then the next part here, the next action we're going to have you take is everybody here that wasn't in DC, we're going to ask you to do what we did in DC. And we're going to ask you to contact your federal legislators to ask for the study. This is Dr. Dawn Turnage presenting on her research publication, Profound Autism Impact on Parental Caregiver Quality of Life. Before I ask and show you guys how to do that, would anybody like to remark on anything they took away from Dawn's presentation? Anything that they felt was a lasting impact from hearing her presentation on this research?
I think it was really like to see what we live be confirmed through, her research and information. I felt like that resonated with me.
I thought it was great as well. This was our first year. I'm Dominic's mom. Sorry, guys, my name changed because I got married in the process of all of this. But I thought the presentation was great. That's exactly what our offices for Ohio wanted, was that data. Ohio is known as having, amazing resources when it comes to our healthcare and our hospital facilities and things like that. But one thing that we had talked about in Senator Moreno's office was he wasn't aware there's only 4 rooms to serve children with autism that are in a crisis. So that was just very eye-opening. I felt like Dawn's presentation really helped initiate a bigger conversation in our offices, at least.
There was one thing that Dawn said, Dr. Cernich. She told us a personal experience, a personal story along with her data about 3 of her caregiver friends who, because they could not get their breaks, because they couldn't get respite, because they, couldn't catch the issue on time to take care of themselves, actually passed away from breast cancer. And we shared that story in our Florida meetings. And that was one of those moments that kind of made the room shift a little bit so that they could really understand the severity of what we mean when we say things like caregiver burnout. And I'm really lucky to also be in Florida and also be university setting where Dr. Turnage actually offered to mentor some of my own research that I'm doing in Florida Atlantic, which is about high acuity caregivers and our participation in the community. So us and our children. So I'm really honored that she would do that with me. And just her research really was a great way to open the door for these legislators who really aren't part of our community to see or understand a little bit more about what we're actually going through.
Yeah. I mean, in my own personal story, I didn't share this in DC, but my brain tumor, when I had to have my craniotomy, it wasn't like an emergency surgery. There's 5 months to prepare for the craniotomy. And Jaden had a waiver, and the state had 5 months to try to find somebody to provide respite for my craniotomy, and were unable to do so. So my mother, who's also providing care for my brother, and at the time was providing care for my grandfather who had vascular dementia and working a full-time job, had to fly down from Pennsylvania on her own dime and take an FMLA to care for me and her granddaughter with profound autism, unpaid, because the state could not find anybody to provide respite so that I could have a craniotomy. And even though respite was part of my waiver benefits, and even though my mother, now retired out of the healthcare field, but was running a medical lab and had worked in the healthcare field her entire life, obviously CPR and first aid certified, her certifications weren't part of a limited vendor list from Tennessee because she's from Pennsylvania. And so they wouldn't even provide her the respite benefit that Jaden did have to reimburse her any part of it. And so, these are kind of, my story's not unique, and that's what caregivers experience. And there was physical therapy that I needed after one of my reconstructive surgeries that I just simply couldn't do because I had no option. I wasn't going to have my mom fly back down so I could go to physical therapy twice a week in Nashville. So I just didn't do that physical therapy because I had nobody to watch Jaden. And so this is a real issue we have within our caregiver community. Michelle?
Jackie, I think another thing for those of you who aren't yet on Medicare, yourselves, or Social Security, my husband is, and I am soon to be, and we're a little along in this journey. The other thing that I always point out to the legislators is, and many of us may not be aware, like my husband, because he quit his job 30 years ago to take care of my son, has no Social Security. He essentially has, and when you start collecting Social Security and your child moves over to getting the 50% of your benefit, essentially, these these are financial things that affect the rest of your life, like your security for the rest of your life. It's not just the income you've lost, but it's also your Social Security benefits and all these other things that, it's never been compensated a penny for, right? But it is what it is. And it affects Ian's future benefits.
It affects the entire country. And so this is the most bipartisan common sense ask we can possibly have. Because, of course, if you're talking to somebody that's in the more progressive side of the aisle, then obviously these stories have the emotional element enough to make them care about it. But if you're talking to even the most far-right fiscal hawks, and like I said, my legislator is one of them. And so the way I presented it to my legislator, I said, this is one of the greatest threats to national security that you're not even paying attention to. People think that foreign wars are a threat to national security. Well, you know what it takes for foreign wars and to defend the country? Money. It takes money to do that. And I said, so what's going to happen in 10 to 15 years when these caregivers who have been providing the entire system on their own, unable to work, haven't been paying into Social Security, they won't have a 401k. A lot of them, 80% of them, are going to be divorced. So they're not going to have their husband's benefits on to be able to use either. And we get this flood into the system of both the caregiver and the person that's been going uncounted in the data all these years, both simultaneously hit the system with full need of the state and the federal government to fund, right? That in and of itself is a major economic tsunami that's coming down the pipe for the country, and they're not even paying attention to it. So even if you end up with a legislator who you feel doesn't particularly care about the emotional impact of different families, talk to them about that angle, and I promise you it's going to start piquing their interest, because it is a real problem that's about to happen in 10 to 15 years if we don't get ahead of this. So for that part of it, let me share what we're going to have you do. Everybody can participate in this again by going to the Take Action campaign hub. My computer will load it. And this one is ask Congress to study the caregivers of severe and profound autism. And again, it's 2 parts. It's going to email your U.S. Senator, both of your U.S. Senators for your state, and whoever your congressperson is for your district. So it'll send 3 emails. And this, again, is where you make this personal. This is why you feel they really need to study us, why we are a unique population, why you feel like all the other caregiver research that's out there isn't really touching on the details that matter for your family. What kinds of stories you've been told or responses you've gotten where providers don't know how to provide care for your child, but they send them home with you. Well, you want to impart that knowledge onto others so that it can outlive you. You would submit that, and then it also has the X post. And then once you do that, then you can share it out. So it's the same exact kind of setup as the other one. Any questions on being able to send out a request on studying the caregivers?
Jackie, I have a quick question. The campaign on sending out to the caregivers, will that go to the people we met with as well? Or are they going to be?
Yeah, so that one is going to go to your federal legislator. So if you were in D.C. and you did get to meet with all 3, you got to meet with both senators and your congressman, then it would be kind of duplicative to send it. But maybe you went to D.C. and you met with 2 or 1 of the 3 and didn't get the opportunity to meet with all 3. Then you could go to that, edit officials, and uncheck the ones you did meet with and leave the one you didn't meet with. So you can still make sure you're hitting all 3, because we want every single person, whether they went to DC or not, to be able to make contact with both their state senators and their congressmen to say, hey, we want you to study specifically severe and profound autism caregivers. We are a unique population, and this is going completely under the radar, and it's very important. It's important for caregiver health. If we're going to keep holding up the entire burden of the system of care, they're probably going to want us to live a little longer. And there are things that we all experience, right? Like everyone on this call probably can't remember the last time they had 8 hours of sleep. So, and what does sleep deprivation do to somebody's brain? What are increased risk of dementia from sleep deprivation, from chronic stress, those kinds of things. So we're accelerating the aging process, and yet we all need to live forever because we don't have a system built yet to provide care for our children. The one way we solve this is to study the caregivers. It's going to solve a lot of problems if we can study the caregivers. Ken, we do have a final ask that isn't related to DC that's come up in the past week related to submitting a public comment with IACC. I'm going to go over that in about 15 minutes, but I wanted to open it back up, open the floor up again for you guys to talk about your experiences with DC or questions you have, or those that didn't go to DC, what questions you might have for us. Just kind of have open discussion time again.
I was supposed to go to DC from New Jersey, but I was wondering, I was Googling while you were talking to get a hold of Dawn Turnage's study. There are paywalls, I guess, where it's published. Does NCSA have a copy of that full study on your website?
We don't have it on the website, but let me reach out to Dawn.
Okay.
I have the report. Jackie, I can email you the PDF and you can share.
Yeah, I have it. I have it too. And I'm sure Dawn wouldn't mind us sharing it with you.
Okay.
But
yeah, I was supposed to go to the conference. I paid for the conference. I had back.
Yeah.
I couldn't make it.
How's your back?
Have a consult with a surgeon on the 13th.
See, this is exactly what we're talking about. Like caregivers have to be able to take care of caregivers, take care of ourselves. So we wish you good health.
Yeah, and I'm in the field of nursing, and this study, I actually did my master's thesis on caregiver stress in the neonatal intensive care unit. So I do have a particular interest in stress.
Maybe the two of you can
right. I wanted to meet her. I know. Yeah. I know. Jill was going to introduce me, but I didn't make it down.
I will. I'll send an email intro to introduce the two of you, because she has two. She has that report, and then she has another report. She has two publications actually. So I will just make sure that you two are introduced on email, and you can get all the.
Is she also a mom?
Yes, she's also mom, and she brought her child with her to DC also.
Yeah, I really wanted to meet her. Okay, thanks so much, Jackie.
Absolutely. Phil and Adam's presentation announced that they are going to start the third Wednesday of every month at, is it 8 p.m. Eastern, Phil? Correct me if I'm wrong. 8 p.m. Eastern, I think. And we will announce this on the Facebook page. But they are going to have a community kind of ad hoc meeting every month with the NCSA community for you to help provide them ways. They want to hear the issues you're facing, the challenges, your ideas, so that they can continue to build up the Helpopedia website to better meet your needs and have the types of resources that you would need on the website. So you guys would be part of that process. Phil, would you like to comment any more on that?
Yeah, it's definitely an open forum for sharing the issues, challenges, and then you'll get to participate in the solutions that we're developing, and that your feedback is valuable to see the results and look at it and comment on it. And because we want it to be as thorough as possible and comprehensive for so many different audiences. So your input is tremendously valuable. Thank you.
And so we'll be sending that announcement out. If you're not already on the NCSA newsletter list, go to our homepage and sign up for the newsletter to make sure you're getting those emails. And also follow us on our socials so you're getting the post there. We have the most activity on Facebook, so that's typically, if you're going to sign up for anything, make sure you follow us there, because that's where if we're going to post anywhere, we will post on Facebook, but we also send things out through the newsletter as well. So we will be getting that information out to you. Anybody else about DC? Questions if you didn't go, or comments on your experiences if you did?
One thing I wanted to add, which may not be part of this, but when I know Steve had talked about the bus rides that he was giving, and so one of the things that I thought when we were watching the video on that is that mobile medical, our population. I mean, there's some of our kids just won't go into doctor's offices, so they don't receive routine care. We used to have a service that did house calls, but they mostly served the geriatric population. But it was nice during the periods we had it, because you could have, you'd have dentists come, you could have EKGs, ultrasounds done. Also, I just wanted to say, like, that kind of sparked a thing with me, thinking like, oh, that would be so great to have in our communities, especially for individuals who are afraid of going into medical settings. And yeah, so that particular presentation was fantastic.
Yeah, if you go back on our YouTube channel and look for behavior constellations, I met a BCBAD when I was at the AADMD conference in 2020, Lee Linder, and he runs Crescent Behavioral Health. He might be in your state, actually, Lisa. He's in one of the Carolinas. I can't remember which. But his parents worked in the old state-run developmental centers. That's where they met. His mom was a nurse, and his dad was some other position. So his mom, when they shut down the state-run developmental centers, his mom became a psych nurse practitioner, and he grew up to become a BCBA, BCBAD eventually. And they decided to form this mobile clinic. And they don't go to family homes right now, but they go to group homes and ICFs in the state. It's the two of them. And so if they medically clear them through the psych nurse practitioner. And if they are medically cleared and they need behavior modification, then the ABA is there to be able to provide a plan for the group home or ICF staff. But as we all know, you can't really modify behaviors when it's due to some kind of medical issue. So having the psych nurse practitioner and working as a multidisciplinary team, and what they came to find out through doing this is they started to develop what he calls these behavior constellations, where people would present with certain behaviors in a cluster of specific behaviors. It automatically would lead them to start testing for a certain type of thing, whether that was H. pylori or UTI or whatever it might be, because they were starting to see that the behaviors weren't just random, that they would occur in these clusters, oftentimes due to a specific medical cause. Really cool program. And so I encourage you to go back and watch that old webinar from us.
I would drive to another state for this.
Steve?
Yeah, to follow up on Lisa's comment on the bus thing, we actually are doing a follow up to that. We had a pilot here in the Utica area for in-home care for medical and a little bit of dental, and it was around the COVID time, just ending. The clinics that were doing it for us, they had new administration. They bailed. We're actively looking right now for somebody else to do that project, because that project, we buried them in work. The kids that couldn't go into those offices that are high, severe autism and complex care individuals who are more comfortable in the home were getting the basics in the home, and where they didn't have to go into these offices where they have a hard time. I had dinner Wednesday night. the Capitol Hill night with Michael Skinner, and we're interested in doing that nationally. Again, we're talking about that. Jackie, I will keep you posted on that. We're looking to tie into one of the big dental places like Delta Dental or somebody, and on the medical side, somebody else that can help us do that model again, because we proved it could work. You know how it is. New administration comes in sometimes and they just can this stuff, and they wanted to say it only worked because it was COVID, but we all know that our kids would be extremely beneficial to have something like that with a mobile type situation. So we are looking into it.
Yeah, and if you're on Facebook, on our page right now, we have a poll going about blood draws. And I'm not talking IVs or ports or anything. I'm just talking about getting a vial of blood to be able to run a CBC or metabolic panel or something. And how do you do that? And a lot of our children, it is extraordinarily challenging. And so if we can't figure out that they have an infection or that, whatever, they have a metabolic issue, whatever it might be, then we can't treat it. And there's a lot of data that's already in the peer-reviewed research showing what a higher risk this population is for preventable fatalities, such as from sepsis or from, constipation, becoming a bowel obstruction, and those kinds of things. So we're always looking for ways to overcome that. And I actually met with somebody this week. That's why I had the poll going, and we're going to be sharing more information on it in coming weeks, how you can get involved in it. But I met somebody this week that developed a device that's already FDA approved. They're going to be looking for pilot hospitals, hospitals that are willing to be pilots for this kind of program. But it's meant to have a trauma-free blood draw. So it's as easy as having a sticker placed on the upper arm, and it warms the area. And there's these tiny little microblades, completely painless, that is able to draw enough blood for most of your critical panels. And they don't know like the person getting it doesn't even know they're having their blood drawn because it's completely painless. So the question is trying to find hospitals that are willing to pilot the program, and we're going to have you involved in that in coming weeks. Phil?
I'm sure children's hospitals in Philadelphia would be willing to do it. And you have already heard of Buzzy and lidocaine, and because I was part of a research study and did do publication on it back in like early 2000s about venipunctures and how to get blood draws from our kids. So there, if you're not familiar with Buzzy, they sell it on Amazon. I've always used lidocaine on my son, and as we all know, having a bad experience really makes, never having that bad experience is the best thing. And we should really be advocating up front for things like lidocaine. It does take usually like 45 minutes to take effect, but, it's well worth the money.
Yeah. Yeah, for sure. So, kind of digressing from our DC things, but it is important for you all to know, like, how broad of a scope of the different areas that NCSA is working on regarding trying to find solutions for our kids. When we go to DC, we have months of a committee planning which planks we're going to focus on, but these are not the only things we're focusing on. There's a lot of different areas that NCSA is touching, and we want your feedback. And a lot of what we invest our time and energy in comes from you guys, comments you have on Facebook or on LinkedIn, or seeing your stories or getting your emails. When we see that there's enough people in the community that care about something, we really do try to make sure that we're finding some way to develop some solutions for you.
I think it does tie in, Jackie, because the message that really resonated with both on the state level and federal level is safety. Because it does become, safety and health. My state specifically, they are in a lot of money in demonstration waiver for they can bill at a rate to provide tailored care management, and you still have individuals who are unable to access basic health care because of their disabilities, and really too just the overall safety and health of the individual. And then we're looking at the settings rule in terms of like I just got schooled by my case manager, like, oh, you have a video camera, you have locks on the door. We had 3 incidents of elopement in the news over the last week, 2 of which ended in fatality. So, I mean, I definitely think it ties into what we were discussing in DC. And at the end of the day, our individuals are not getting the care and treatment that they need and deserve.
100%. And that takes us to, that's a good segue for our last thing. So this is more general and broad. As many of you probably know, the IACC, so if you've been with NCSA for a while, back in 2024, we lobbied heavily to have the Autism Cares Act reauthorized. And that was a very difficult year to get anything passed in Congress. There was a long CR. If you remember, December of that year, they didn't pass childhood cancer laws. They didn't pass. There was so much they did not pass, but they did pass the Autism Cares Act. So it was through heavy, heavy advocacy coming largely from our community. And part of the Autism Cares Act of 2024 is the directive for IACC to develop a strategic plan to direct that funding and to direct NIH on the research. And the Autism Cares Act of 2024 approved $1.95 billion for research. So IACC didn't meet at all in 2025. There was not one single meeting at all. In opposition to what the law said, there was not a single meeting in 2025. Then they were reconstituted this year. There's a new IACC. They had one meeting, and then out comes this 336-page draft, working draft of the strategic plan. Originally, they were going to give us 4 days to review it and submit public comment and try to have it approved on the 31st of this month. But this week, you guys showed up in full force. We were able to get an extension. So now the new deadline is August 20th at 5 o'clock. It is still a 336-page document. So if you would like any assistance, if you start to read this and there are certain clauses that you're not understanding or that you have questions about, we do have a form for you that you can just fill the form out and send us the questions, and we will be responding to those. But we also, once you do feel comfortable with the plan, or with the draft, and you feel like you fully understand it and you understand what's written in there, then we want you to submit a public comment, your own. We're not telling you what to say, but we have developed a template for you. And I will show you that. That's also right there in our action center. So you guys are going to get really comfortable with our action center. So you go to back to campaigns, and it's right here. IACC public comment on strategic working plan draft. So right here, if you want to read the whole document, if you click this, you'll see it opens the whole document. You can download it, you can print it, you can do whatever you want with this, but this is a lot to go through, right? And then it says right here, if you have, if needed, and you would like to request support about anything in there, you can click this form. Okay, and then it'll open up this form. You would say what page number of the document so that we know what it is. You just copy and paste whatever you have a question about. And then you say, you click one of these. I have a question about this. I want NCSA to oppose this, or I want NCSA to support this, or other. You can write in. And then what other information NCSA can provide to help you feel ready to submit your public comment. And then if you do want us to return a message to you about this, you want a response from us, we're going to need your email because we're not capturing emails here. This is all anonymized. We're not capturing your email. We won't know how to respond to you if you don't put your email there and you submit it. And then Christina and I are monitoring that in the back end, and we will be working through to respond to those. Go back to and when you are ready to write your public comment, it's going to go exactly where IACC, like if you go to IACC's web page, it'll say, what the email address is, and it's going to go to Dr. Rebecca Martin, who is exactly where IACC says to send it. So it's going to the IACC email, public inquiries email. And the subject is going to be personal public comment. And then it's just Dear Rebecca Martin. The chair is Sylvia Vogel and members of the Interagency Autism Coordinating Committee. And this is just a draft template. You're going to edit this, and you are going to this is just giving you ideas of how to write this. This should be your own. So you can completely delete this if you want. You can tell the committee who you are. For example, I'm the parent, I'm the grandparent, I'm the sibling, whatever it might be, of a 25-year-old, a 12-year-old, a 42-year-old, whatever. You're going to point to something in the draft. You're going to show them you have read the draft. You're going to point to something in the draft that you were glad to see. And name the section, if you can, something you do want them to support. An area where you think they can change it or strengthen it. Then you're going to point to something that maybe it leaves out that does matter to you. And then connect it to your life in a few sentences and click submit. And it's going to go. It's going to fly out to the IACC. And you have formally submitted a public comment. You will get a confirmation email once you submit that. So that is how we are going to have you share we are going to have you submit your public comments to IACC. We want everybody to participate in this. We're not telling you what to say, but this draft will direct research for the next 2 years at least. So it's really important that you understand what's in it and that you are responding to it, because this is going to directly impact everybody's lives that's on this call here today. So does anybody have any questions about how to submit a public comment or using the form if you have any questions?
Is this on the NCSA website?
Mm-hmm. This is on our Action Center, yes.
Okay.
Okay, guys, we've got about 9 minutes left, so open forum for you guys. And Christina, are you watching chat? Because I have not been. Is there anything we need to answer? So that is that's what we have to share with you guys. Make sure you know that ncsautism.org/take-action, right? That's our action center. So there's lots of things for you to do in there. But the main things from this debriefing that we would like you to do is to contact your state officials to ask them to make sure they're prioritizing severe and profound autism in their Medicaid decisions. Because whether the federal government gives them $1 trillion per state or $10 per state, the states decide how that money is distributed. And so they have broad discretion on how to spend those Medicaid dollars. And we want to make sure that we're letting them know we're watching. We want them to be prioritizing the dollars with those that need 24/7 care. Oh, Jill's here. Sorry, too loud here to talk. Looking forward to next steps. Yep. And then, so send to your state legislators. And then for your federal legislators, you're going to ask them to do the caregiver study. And you are going to read the very long strategic plan draft. Ask us if you have any questions, and then submit your public comment before August 20th. So those are the main action steps that we have for you guys, whether you participated in DC or not. If you did go to DC, you have the extra 2 steps of the thank you and the follow-up, if you haven't already done that.
All the questions in the chat seem to have been mostly resolved, but maybe Jackie, just in the recap to this meeting that gets dispersed out, just list out all of these things. But other than that, that's all I had.
Yeah, absolutely. We can send another newsletter out to with some of the action steps from this meeting. And there were 2 other things too. I needed to fix the quorum thing in the back end for the thank you, so it's not set
on Turdage.
Yeah, so it's not only your legislators. I needed to contact. Oh, who was going to contact me about whose legislator wasn't correct on quorum?
Me, Sherry in Florida.
Okay. Yeah, Sherry, if you can send me that email so that I can contact quorum support. And then I'm going to do an intro with Dawn Turnage and Kathleen. Those are my action steps after this.
Did you say something was wrong with the link? The voice?
Yeah, you're right. Just to delete the subtitle where it's a little confusing because it still says voices, but it is the correct link. It's just the subtitle.
So for my sake, I already sent the thank yous and the follow-ups, and I did it through that. I'm okay.
It actually, everything else was correct. It's specific to DC 26. It was specific to our policy planks. Everything was there. The subtitle was missed, so I just have to fix that.
Okay.
So it's not confusing.
Just to clarify, we met with a staffer from Schiff, and I was able to pull up his drop down, but you were saying like I wouldn't be able to pull up another state staffer. Is that what you were saying?
Well, at this moment, not, but that's one of the things I'm going to fix after this is that you would be able to message anybody that you needed. But because when I set that, it's going to look a little different. It won't auto-populate the 3 legislators. It will have the search box there, and you'll have to type it in like I did when I showed you when I typed in Kustoff and it showed Kustoff, right? That's how it'll do that when I take that option off, that it only shows your legislators, which I'm going to do after this call.
Okay, thank you.
In fact, these last 5 minutes, why don't you guys share any last details you have, feedback, anything on the event, and I'm going to go off screen and fix it in the background so it's fixed before we get off this call. Just jump in whenever you want.
I wasn't on, and I'm sorry, you guys. I'll just give you guys feedback from when I went. The lady that I met with, his staffer was very young, and it felt like she really didn't care that much. I'm going to follow up with her. I just felt that it was kind of unfortunate that I don't know. I didn't get someone that maybe was a little bit more engaged.
Was that who was that? Was that Star?
It's me, yeah.
So are you talking McConnell's office?
Yes.
Yeah, well, it is good to know. It is good to know. And I want you to put that in your in the back end when you log your interaction. Make sure you're naming the person that you met with there. And because next year, say you can't go, but say somebody else from Kentucky goes. And obviously it won't be McConnell there next year, but that staffer might be in another senator's office next year. And we would know ahead of time going into it, what their kind of disposition was. So we could better prepare the advocate for that in the following year.
Okay.
That was the same thing for us in Ohio when we met with Carrie's office. We actually ran into Carrie prior to meeting with his staffer. He took a picture with us, posted it on social media. That was good feedback. But his staffer wasn't really that interested. So kind of used for like a photo op.
Yeah, that was how it was the first year for a lot more offices. We actually had a lot better reception this year, but disappointing to hear that. So definitely make sure we have that information in the back end. And it says advocates can choose who they communicate with. Any advocates. And I don't have it checked that you can only contact your representatives. So,
Jackie, I noticed too for us, our office address was listed. So those were the legislators that we got. I did go back in though. Once I updated to my home address, I was able to knock out Delaware, Ohio. So did I do that right?
Yes.
Okay.
Yeah, it should let you contact anybody. So because it's already set that way. So let me make sure.
I was going to say, I did it before you went back in and it worked just fine as soon as I adjusted the address.
Yeah, let me see. Right. Edit officials. I will troubleshoot this on the back end because I will show you guys here. I'm going to share the screen real quick because I have the contact form. I don't know why it's not letting you enter in other officials because I already have it set that way. So this is the back end of quorum. And you see advocates can only contact their own representatives. That's unchecked. I do not have it checked. So I don't know why. Because when I go into here to send the thank you, it's only showing the 3 officials. And when I click edit, there's no way to add another person. So, Christina, any ideas? You're pretty quorum savvy. If I have this unchecked, why is it not letting?
Jackie, I think Christina had to leave. That's
okay.
Not chat.
Okay. Well, I will get it fixed. I don't know what the problem is. I will be contacting quorum about that. But in the meantime, if you need to send a thank you to a legislator that's not listed, reach out to us. We'll send you their email. Joan?
Lori's doing.
Jackie, I'm so grateful for all the work you and Jill and so many have done. I was not able to attend this year, but I have a question about IAC. Haven't they been extremely resistant to any of our endeavors, including Jill's comments and in previous years? And do you really feel like public comment will make a difference?
So, it's no secret there hasn't been a lot of love lost between former renditions of the IAC and NCSA. You can search IAC on our website and see plenty of pretty heavy critiques from NCSA of the IAC in former years. And this is a completely new IAC. This one, I will say, is much more focused specifically on severe and profound autism, so that's good. It's not, though, that means that we just give a blank slate yay to everything when just because they're focusing on severe and profound autism. So it is still really important for us to go through in detail every clause to make sure that it is stuff that we want them to be focusing on the research for. But in general, they definitely are focusing more on our population than prior versions did. So that's the good news. Additionally, and this came up actually on social media quite a bit. And this week, people were like, where was this big campaign in 2024 and all these things? And well, NCSA's grassroots network was established in 2023. It didn't really start getting underway until 2024. And in 2024, we were pretty busy on the Autism Cares Act. Very, very busy.
Absolutely.
And our grassroots network has continued to grow, and we are a strong, very capable force now. And I think that's what definitely was noticed this year, this past week, that if something is going on, we have a community that can be activated very quickly. You guys were able to move a federal agency to change the timing of a public comment within hours. And it wasn't just the Grassroots Network. We had all the major autism organizations signed on a letter in support of it, because no matter which part of the spectrum you're serving, it didn't serve any part of the spectrum to have 4 days to look over 336 pages and make a public comment. And then we had the campaign, which you guys submitted. And then in addition to that, we had a lot of legislators, senators and congressmen that also were sending letters to HHS saying, hey, these families and individuals with autism deserve more time, extend the deadline. And so that was very effective. We have had a significant increase in public comments since NCSA has invested in the software. It started, I don't know what, it was right before the inauguration. So it would have been January 2025, right? Was the first time that we used the software for you to submit a public comment. And that was on 14C. And there was over 400 people that submitted public comment on that. And then, of course, we've utilized it in other ways. The last IAC meeting, this IAC meeting, and it was also noted this week by federal agencies, this huge uptick in public comments that they had for the last meeting, more than they had in any other meeting prior to. Well, it's because we're utilizing our software, and we are engaging with our community to make sure they understand what a public comment is, how to do it, why it's important, being able to answer your questions, and it is making an impact. So yes, the short answer is yes. Making a public comment absolutely does make an impact with these federal agencies.
Thank you, Jackie.
Okay, guys, any final last words? All right. Well, we thank you for all of those who were able to make it out to DC. We understood that it is a hardship for a lot of people, and it's not possible for many. So if you weren't able to go, know that we mentioned you there. That every person that went on the Hill understood that they weren't just advocating for themselves and their family, that they were acting as ambassadors for the entire community, and for especially those that are experiencing greater hardships than we were ourselves and didn't have the ability to get to DC. So you were not forgotten. You were not overlooked. We certainly were carrying you with us when we went to the Hill. And we hope that more of you will be able to attend next year, and those that did this year will be able to return. It's just an extraordinary experience being around so many other families that just get it. And Ashley Valdez and Jillian also wrote up incredible recaps of the event that are available on Substack. If you weren't there, to read through those and see what their perspective of the experience was. I'm really grateful for their recaps, because it meant that we didn't have to write one. They did a really great job. But that's what I have. Jonah, you've been quiet. You're member of our board and was a sponsor this year through Words Bookstore. Would you like to say any final last words?
Actually, I was just typing in the chat to thank you so much to you and Christina and to everybody. DC was amazing, and to all of you for your incredible advocacy. It's just so important. So thank you.
Thank you. You guys are really making a difference. So keep at it. Utilize that Take Action Center. It is certainly getting the attention federally, and we want to start getting the attention statewide too. So use those action steps, and we will be meeting again soon. Thank you, everyone.